Stress can show up in various ways, such as feeling overwhelmed or anxious, becoming easily irritated and having trouble focusing. People might experience physical signs like headaches, muscle tension or sleep problems, and even changes in appetite, maybe eating more than usual or eating less than usual. All of these are really common symptoms that might occur for people. And I would say if people notice changes in either mood or behaviour, it's important that they check in with themselves and consider whether stress might be the cause. I typically see clients struggling with stress and burnout due to work, and often it's because of pressurized work environments where there might be tighter deadlines, increased work demands, or perhaps even unsupportive management or leadership within teams. Big life changes like moving or losing a job or personal loss can also be major stressors. And in my practice, I do tend to see clients dealing with the stress of balancing various responsibilities, especially in this fast-paced world. Learning some techniques to cope with stress, to cope with the emotion of stress in the moment can be really helpful. This can help to bring down the intensity of the feeling in the body, both emotionally and physiologically. Something like a deep breathing exercise to slow down the body, or even a 2-minute dance to your favourite upbeat track. These examples are very physical and can be really great for getting us out of our head and helping us to reduce physical tension at the same time. I'd also say considering small steps that someone can start with. So something like saying no to maybe 1 or 2 commitments in the week, whether that's work related or personal from their personal life. And this would be just to buy them some time for them to then use to rest or do something enjoyable. It can also be really helpful to open up to people around you, so to get emotional support, but also getting help in more practical ways, so whether that might be at work or with childcare, for example. And finally, I'd say being kinder to ourselves. The more stressful things get, the harder we tend to be on ourselves, believing that we need to get things done better or quicker, or feeling like a failure because we're struggling in some way. So rather than berating ourselves, it can be really helpful to offer ourselves some compassion and kind words instead. Stress can negatively impact both mental and physical health. Mentally or emotionally, it can lead to anxiety, depression, or burnout. Physically, stress may cause exhaustion, headaches, digestive issues. And we know from research that being exposed to chronic stress over time weakens the immune system, therefore making it harder for the body to fight off illnesses. So we know that it can be various external factors that can lead to stress, but often we don't have control over these things. And we can't change our work environment so easily, for example. So in therapy, we look at some of the factors that might be contributing to stress in a more personal way. And this is where we have a greater degree of control. So I use cognitive behavioural therapy, which can be really helpful for people in helping them address unhelpful thinking patterns that might be contributing to stress. We also look at relaxation techniques like guided breathing or progressive muscle relaxation. And I focus on helping clients to develop practical coping skills and long-term strategies for managing stress effectively.